Welcome to Speak Your Mind on Gold FM with me, Louise Kaunisella. You have to get used to being invisible. If you become or are an anesthetist, a large percentage of the public has no idea what the job involves and how you become one. The Pacific Society of Anesthetists will have their 30th regional annual meeting from the 26th to the 31st August at the Fijian Hotel in Singatoka. So to find out more on what the meeting will be about, as well as the role of anesthetist, my guest today is from the CWM Hospital, and he is the anesthetist consultant, Dr. Bavou. Welcome to Speak Your Mind.
Welcome, Louise. Thank you for having me on your show today.
Oh, it's great to have you. Yes, thank you indeed. Now, just before we move on with the exact description of the job that you do, just tell us a little bit about yourself, please, Doctor.
Okay, my name is Dr. Bavou. Originally from Ra. My mother's from Rutuma. I've been working in the anesthetic field for 10 years this year, and married with 2 kids.
Lovely. Great to know. Okay, so first question, what does an anesthetist do?
Right, so just to keep it simple, the role of an anesthetist is to look after you during the perioperative period. So just to, again, to
So when you say perioperative, that's before?
Before, during, and after.
Oh, okay, so that's
Right.
all included.
So,
Thank you, yes?
Before, when I say before, I mean we clinically assess our patients and make sure that they're actually fit to undergo surgery.
Right.
During the operation, we are the ones who are there with them throughout the operations, keeping a close eye on them.
Oh, I thought only the surgeons were in an
They are
operation
operating,
room.
but we are the ones providing the anesthesia
See?
for surgeons to carry out their jobs effectively.
Right.
And immediately afterwards, in the post-operative period, we are our patients still come under our care.
Okay, so I mean, that's how it is described. So is an anesthetist a doctor?
Yes, very much so, Louise. We are all doctors. We are an anesthetist. You have to train for the basic medical qualification, the Bachelor of Medicine and Surgery that takes 6 years,
Okay.
which is provided here in Fiji by previously by Fiji School of Medicine, now Fiji National University, the School of Medical Sciences,
Right.
and also University of Fiji in the West.
Okay.
So that's 6 years to get your basic medical qualification, and then another 4 years
To become an
to
anesthetist.
specialize in
in-
the field of anesthesia.
Ooh, 10 years of schooling. Yeah.
Yes.
Wow, that's
Essentially.
a long time. Okay, thank you. That's good to know. So is being an anesthetist a rewarding job, and why?
Being an anesthetist is indeed a rewarding job, Louise. Many a time we find ourselves having to care for very, very, very sick patients who need emergency procedures. So in that sense, their lives are literally in our hands. And every day we are at the hospital providing anesthesia, making sure that patients go to sleep safely, wake up safely, that patients undergo surgical procedures pain-free. And I didn't elaborate on this earlier, but we are also responsible for other services like the intensive care unit, hyperbaric services, and pain management in the hospital.
I mean, no one likes pain. It's the worst thing ever.
No, yes.
So, I mean, you are very important in our lives, that's for sure. Okay, so what exactly is anesthesia?
So anesthesia, we can say it's a state of controlled loss of consciousness or awareness that you induce to a patient or to a person who is about to undergo a medical procedure. And this often includes other things like providing pain relief, muscle relaxation, or paralyzing you if need be for major operations, for example.
Okay.
And yeah, basically,
Okay.
yeah, anesthesia.
So when you spoke about it being a rewarding job, it makes you feel good that you're helping people to not feel pain?
It does. It does. That is one of our important aspects of our job. And fairly recently, we have made efforts to improve our pain service, as we call it in hospital. Because if you go to the hospital on any given day, you will find a lot of patients whose pain is not treated adequately,
Mm.
or and our role there is to make sure that they get the best pain relief as possible, whether
Yeah.
it be with pharmacological means or other techniques
That you
that we
specialize in.
specialize in. Yeah.
Oh, okay. So what drugs are in anesthesia?
Right. We could spend I think a few hours talking about that, but
I mean, for example, maybe some.
so we'll just to mention briefly the main drugs that are used. So
Mhm.
everyone knows us as the people who put people to sleep, the
Mhm.
doctors. So the drugs that most people think of when you're going to sleep, they're called induction drugs. So
Okay.
that's we'll just mention classes of drugs.
Okay.
So you have those type of drugs that actually put you to sleep or make you lose consciousness.
For example, if you're
hypnotize.
going to get a cesarean delivering a baby, maybe.
Right. So
That's one, yeah.
if you were to have a procedure like that, we don't commonly put you to sleep unless
Oh.
there is a strong reason to.
It can
What
be
we usually do
dangerous.
is, yes, they all have their risks.
Ooh,
So what we would do is we'd use another class of drugs called local anesthetics.
I see.
And most women who have seizures, they get an injection in their back. It's called a spinal anesthetic, where we just numb the lower half of their body.
Okay.
So you've got induction drugs, spinal anesthetics, drugs that paralyze you, muscle relaxants. At times we need to paralyze patients and keep them. We take over their breathing, basically.
Wow. You
Yeah.
take over their breathing. So how do you do that?
Once we've paralyzed them, then we connect them to a ventilator.
Oh, I see. Right.
And as you may have seen in the movies,
Yes.
or there's a tube coming out of your mouth.
Yes.
Basically, we
So
need,
you even do that as well as
that
an
is all part of our
anesthetist?
job. Yes. Yeah. So those class of drugs include. I guess the other main important one, since we've been talking about pain, is opioids, things like morphine that most people
Oh,
think
yeah,
about.
very
and-
familiar with those drugs, but
Yes.
we'll get back to that
Sure.
soon.
Yeah.
On Speak Your Mind, Gold FM, only the classic hits. Do stay with us if you can. Welcome back to Speak Your Mind on Gold FM, only the classic hits. Our guest in the studio with us today has been kind enough to drop by, and he is the anesthetist consultant at the CWM Hospital, Dr. Shem Bavou. And when we left off, I asked you about, some examples of the drugs that you use for anesthesia. So you mentioned the opioid, which is pretty common because I know that Prince, who happens to, be one of our singers. Yes, I mean, he died of an overdose of that. I mean, that's because he had pain. He had something like a hip problem. But yes, and then you described morphine, which is, I would say, the really stronger drugs that
Yeah.
you must use. So,
Exactly.
yeah, you can carry on from there.
Yeah. So we've talked about the muscle relaxants, the induction agents, pain relief, opioids, as an example.
Mhm.
And you have, I guess, the gas that actually keeps you. We call them inhalational agents.
Oh, my.
So once we put you to sleep,
Mm.
we don't usually keep giving you something through your IV drip, if you recall.
Mhm.
You actually end up, what happens is that puts you to sleep, and then you breathe in the inhalational agent, which is what essentially keeps you asleep.
Wow, boy, something. No wonder you have to study for that long. I mean, it's a life-death situation. It might be a bit scary for someone
Yes.
to even be an anesthetist.
A few tense moments
Yes.
initially, early on when I started, but
Yeah. I suppose you have to have, be a person who has to remain calm having a job
exactly,
like
Louise.
this.
Yes.
Okay.
much so.
So, do we have many anesthetists working around the country, or do we need more?
Short answer to that is we need more.
Okay.
At the moment, we'll start from the west, so Lotoka, 15 in total. And in Lambasa, there are 7 local ones, local anesthetists with, I think, 2 new consultants have just joined, expatriates.
Okay, that's nice.
Yes, and in Suva, we have a mixture of both local and regional trainees. So close to 30 in total.
Oh, so
but when the regional trainees leave at the end of the year, they go back to their country, so that number is vastly reduced.
okay.
Yeah.
Okay,
Below
so
20, yeah.
we definitely need more anesthetists, obviously. And why not? I mean, it has a, I know that you're like the surgeon, so it's good pay. I'm sure you can entice people to become an anesthetist.
Yes, I guess we're always looking for new recruits, new people, new doctors to join our department. And, part of the reason why we are always in need of people leave. People look for greener pastures, I guess. And in the past, retaining our trainees was an issue, but the numbers are slowly coming up, and we are training more.
That's good.
Plus, the number of sick people in our hospitals is not decreasing.
I know. I can imagine. I mean, the population, so we've got so much population now. So that would be a challenge. Yes, but you're doing a great job. I mean, you have the passion, obviously. You've been in Fiji doing your good work for 10 years now. So you, I must say, highly experienced. So you can, so how do you try to convince doctors to get to study?
To actually study anesthesia.
Yeah. Do you
I
try
think it's
to
all
entice
about
them?
not so much enticement, but just clearly portraying a picture of what it involves. And it's not all. It's not going to be an easy. Most people think, the classic big. When someone says anesthesia, it's the doctor who puts the patient to sleep and is doing crosswords while the surgeon's actually doing the work. It's a common joke, but
okay.
Yeah, I would like to think that we would attract more doctors is basically inform them of how many years it'll involve in terms of training.
So that's only another 4 after the 6 that they've
only
done.
Only another 4. And there's more to anesthesia than just putting people to sleep and working in the OT. As I've said, we are responsible for the intensive care unit services. Hyperbaric, when it's hyperbaric, people who have bends or the divers who come in, they get, I'm sure you've heard that.
I've heard of,
the
yes.
divers who go diving without the proper equipment and training, come in paralyzed, and so we take over and we manage them.
Okay.
And the our pain clinic or our pain management team is something, another new initiative.
That the CWM has now?
That, yes, our head of department, Dr. Lukina Sandra, has initiated in the last year or so.
Okay, so we got plenty of those drugs in the hospital to treat the patients.
Oh, we still have our issues with drug supply at times, but for the most part, yes.
Okay, so I mean, the thing is that got to me was you saying that you even control the breathing of a patient that you treat. That is, sounds really scary to me. So you hook them up to that ventilator machine?
Yes, for major operations. For example, if you have to have an appendix or have your gallbladder taken out, you must be paralyzed, meaning we basically stop your breathing, we relax all your muscles, not your muscles in your heart. That's different, but just your major muscles, and then we take over your breathing.
Interesting. Now, is it possible to wake up during surgery?
Yes, Louise, it is actually possible, and there have been, if you look in the literature, there have been different accounts by people that they come back and testify that they were aware that people were talking, people were saying things about them, things like this, and this is usually when they are not anesthetized enough, to put it simply. And you'd have occasions when you would have to keep the anesthesia light, so to speak.
Okay.
It's usually in a scenario where it's an emergency procedure. For example, a patient has lost a lot of blood, or a patient does not need that much anesthetic to keep asleep. So if you came in with, you've lost half your blood volume, you would already be asleep. I wouldn't have to give much to you to put you asleep.
Okay, I
But
get
the
it.
downside of that is keeping the patient light.
Mm.
The patient would sort of would have some degree of awareness.
I see,
which
but
is
at
what we
least no pain.
Yes, definitely not pain.
Oh, that's
Yes,
better then.
yes.
On Speak Your Mind, Gold FM, only the classic hits. Don't go anywhere. We'll be back in a moment. This is Speak Your Mind on Gold FM. Only the classic hits. I do hope you're enjoying the program. Our guest in the studio from the CWM Hospital, he is the anesthetist consultant, Dr. Shem Bavou. A lot of experience. Now, doctor, people need to know how to prepare themselves before going into surgery to avoid complications. Could you elaborate on this, please?
Thank you, Louise. So before actually going to have an anesthetic, what one would routinely have to do is have a sit down with one of the anesthetists at, say, a preoperative clinic, where the anesthetist would explain to you what type of anesthetic is suitable for that particular procedure. That's part of it. The other thing is the anesthetist also has to look at what condition the patient has, what other problems the patient may have. When I say problems, patient may be diabetic, may have high blood pressure, all these other medical conditions that do affect how we give our anesthetic.
Right.
But more importantly, does affect the risk of an anesthetic. So with any anesthetic, if I was to give someone an anesthetic, there are always risks involved, and that's, I think, the most important issue that would have to be clearly explained to the patient. Even if you were the most healthiest person in Fiji, if you were to undergo an anesthetic, there is still a risk that something may happen.
Okay.
Even if it is less than 0.1% or whatever it is.
There's no question about it.
Yes. Now, the risk is higher, obviously, if you have more medical conditions.
Right. I believe asthmatics are a problem for...
Asthma is one of the major comorbidities or medical conditions that do affect how we give our anesthetic or how we prepare for anesthetic. And it also depends on, how well controlled it is. You can be an there are many asthmatics who come in for surgeries every day. The issue with something, for example, like asthma, is how well controlled it is.
Okay.
Or how severe the severity, their compliance with their... So that all comes into play.
There must be a tough one for you. But you trained. I mean, that's your specialty, obviously. So
it's all about explaining the risk and making sure that the patient also understands the risk.
Okay, so the patient has to be calm as well?
Ideally, we'd like the patients not to be nervous. Obviously, the other things that we do explain is what will happen. They come in, they'll have a few drips or needles put in there. Explain to them clearly what is the process when we take them into the operating room.
Because it must be a scary moment.
It is for someone who will be coming in for the first time.
Okay.
And it's not just adults. We have to remember it's older people, it's younger kids.
I know, even children.
And babies, and you have a wide variety of people. So your approach to different age groups may be a bit different. For example, children may need to come in with their parents before they go to sleep.
It's actually quite sad when you think about it. Yes. I mean, it's but like the support of the parents and the job that you do is something else. How do you describe the specialty of an anesthetist?
To a patient who comes, or to
I
anyone?
Mean, any which way.
I think that an anesthetist is someone who safely, who looks after you when you are having a major operation, who makes sure you're safe, you're comfortable, you're free of pain, and that you wake up as safely as possible. And again, the role of the anesthetist has broadened over the, not only here but overseas. So other things like we do intensive care, hyperbaric service that I mentioned, and looking after pain.
Okay. So just going to my earlier question, what are people to know to prepare themselves before going into surgery? They're not allowed to eat and
Right.
stuff
So
like that?
yeah, exactly, Louise. So important things to know, for patients to note, their fasting status. 6 hours is the standard for nil by mouth. So you're not allowed to eat food at least 6 hours prior to coming to theater for operation.
Theater, yeah.
Yes.
So, I mean, for example, if someone eats, on the side, that's a big no-no. That's what could...
That is a big no-no, and we trust that the patients are honest with us. If they are not, that will just increase the risk of them aspirating or vomiting when we put them to sleep.
Oh, I see.
So when you're asleep or when you are actually going to sleep after we've given you the drug, you lose your control to safely guard your airway, put it that way.
Okay.
So if you are conscious, fully awake, if you vomited, most of it would, you think that when you vomit, everything comes out. But when you're asleep, as an example, if you do vomit, the chance of choking, the food and whatnot,
the complications
going back
right there and then.
Yeah.
So it's a strict rule not to eat 6 hours before you go into theater. And this is always made clear to the patient.
We like to think that it's always made clear, but a few times it's not made clear to the patients, and we have procedures deferred, and it's not always the patient's fault.
Oh, okay.
Sometimes it's a communication problem with the medical side and the patients.
So it happens.
Yes,
Okay.
it happens.
All right. So another question I have here is, what is the difference between an anesthesiologist and a nurse anesthetist?
Right. So an
Anesthetist.
Thank you for the question.
Very hard.
An anesthesiologist, that's more a term used by an American term.
Oh, I see.
Anesthesiologist is sort of like a same thing as an anesthetist.
Okay, right.
Now, a nurse anesthetist is a highly trained, specialized nurse.
Okay.
Who has trained in the field of anesthesia and can basically give anesthetics like an anesthetist.
Okay, so like for how long does that nurse have to be in the nursing field to be able to
Now, I'm not too sure about that, Louise, because we don't have nurse anesthetists in Fiji.
We
but
don't yet? Okay.
That's because we have adequate numbers.
Oh, okay.
I'd say, we're still short, but nurse anesthetists, you'll find them as being the sole anesthesia providers in other Pacific countries where their numbers are way lower than ours.
Okay.
So they've got, they don't have enough doctors to man all these theaters, but they have a nurse there, so that nurse sort of specializes, they takes your training a bit further, specializes in anesthesia, so you don't physically have to have one anesthetist go to all these hospitals. You can just train them, and they give provide anesthetics themselves.
Okay, so that's clear with the nurses being able to do your job.
Please.
On Speak Your Mind, Gold FM, only the classic hits. We'll be back soon. Speak Your Mind on Gold FM, only the classic hits. Thank you a lot for your company. Our guest in the studio today has come from the CWM Hospital, and he is the anesthetist consultant, Dr. Shem Bavou. And, this job that you do, not many people realize how important of a job it is. So it's really good to have you on the show today. But do anesthetists get paid more than surgeons, or maybe around the same?
Right. So, you think of it like in the doctors working in the public sector versus the private.
Okay.
So, in the public system, say a surgical a surgeon and an anesthetist. They would, how it works in the ministry is you have pay scales according to your position. So you might start at medical officer, go up to a senior medical officer. So a medical officer in the anesthesia department versus a surgeon at the medical officer level,
Yes.
they would get basically the same. Now, it depends if you move up, if you get promoted, so you become a senior medical officer in the anesthesia department,
Right.
compared to a medical officer, a junior surgeon. Obviously, that person would get paid. The one in the anesthesia department would get paid more. But as you go up again in your department, the pay scales are same. But generally, in the private sector, I think surgeons get, from what I've heard, is I think the surgeons do get paid a bit more.
A bit
And
more.
yeah, there's nothing like that pay scale there that applies to the public system. Yeah, that's a short,
Okay.
easy answer.
So, but there's one thing. A surgery cannot go ahead without an anesthetist. Obviously. The surgeon can do his job
Yes.
without you, or
The surgeon. So if a surgeon was to do a procedure like removing a lump from or removing a fingernail, toenail or fingernail, what they could do is they won't need us to be physically there. What they could do is just numb, for example,
okay.
numb your finger and they could do that by themselves.
Okay.
So that's surgical. You can say
Procedure.
that's surgery without us.
Okay.
But for bigger things, for more complex procedures, generally we need to be there.
Yes.
And it's because they need to focus on their job. They need to treat the patient, sort out whatever surgical emergency or surgical issue needs to be sorted out, without having to worry about how the patient is keeping the patient alive. So that's our job.
Okay.
on the other
So,
end.
man, that's teamwork.
It is teamwork, and it's not to say that they need us. We need each other,
Yes.
to put it that way. Yes.
Okay, that's good to know. Now, I believe you've already mentioned it. You've expanded your services with anesthetists looking after the intensive care unit. Can you tell us about how this came about
So
and when?
intensive care unit services, this came about in the late, from memory, I think the late 90s. And at that time, 96, 97, was it? At that time, our intensive care unit obviously was not set up as it is today. And I believe it is a government official who needed some higher level of some intensive care level of medical care. And it was found that there was none it was not available in Fiji. So that brought about, a few changes, and it took a few years for the intensive care unit services to be set up and work well, basically. And at present, we have a unit that can, house up to more than 10 patients. Although we are struggling to meet that number because of ongoing shortages with supplies, drugs, manpower.
Okay.
So yes.
Okay. So could you tell us about the pain management unit?
Right. So the pain
So
management.
this is a pretty new thing as well.
It is relatively new within the last
Relatively,
year or so, and the initiative came about when we realized that a lot of patients in the ward in hospital who had pain issues that were not well controlled. Either they were not receiving adequate pain relief, or they were not on the appropriate pain relief drug.
Yes.
And it wouldn't be too uncommon to go into the ward and see a patient in
Pain.
pain,
Oh,
basically.
horrible.
And that affects the patient's obviously mobility, and we have chronic issues like chronic pain,
Horrible.
which can still affect patients even when they go home and they still suffer from these syndromes.
True, especially if you, for example, cancer.
Yes, cancer
That's,
pain is also
terminal.
another.
That's really horrible.
Yes.
So you take control of their.
In terms of cancer pain, we work closely with the oncology unit, but it's all about treating the pain in the end.
Yeah.
So cancer patients are they have special set again, cancer pain. The oncology unit at CWM treats and manages them, and we support them. There's a need to.
Man, I mean, geez, I just think of, having pain. You're the first person I'll come and see to get the more, a good drug so I
pain
can't
relief.
feel the pain. I mean, nothing worse in your life. I mean, when I have pain, ooh, I can't take it. I even have to cry to relieve, relieve the pain. I think that's a good way of relieving pain too, by crying. Anyway, everyone has their own ways of dealing with their pain.
Stress, pain.
Yes, but I mean, for you guys, you do the more serious work about it. So maybe you'd like to tell us about the upcoming, you've got a meeting, which will be the 30th regional one for anesthetists.
Yes, so it's the Pacific Society of Anesthetists annual refresher course or meeting that will be held from August 26th to the 30th. I think it's a Friday, yes.
So when we say 30th, it's held in different countries?
So it's the first one was held in 1989 from memory. And
Okay.
that was, for the first few years, it was just held in Fiji. And following that, we decided to, it's been held in other Pacific Island countries. So there was the idea that one year we might have it in Fiji, the next year a Pacific Island country.
Okay.
And all the member countries, about 13 member countries of the PSA, and a lot of these, and the anesthetists in these other countries have trained through medical school in Fiji. Many of them are my colleagues, my senior colleagues that have gone on and are providing anesthetic services in their countries. And this year, the main reason for having this meeting every year is to basically provide a forum for anesthetists in the region, the Pacific region, to come together, share ideas, network, share experiences on, because geographically we are very spread far apart. And at times in our specialty, we find that you are working alone in isolated areas. And a conference such as this is a good chance to bring specialists in our field together so we can share, learn, and say, okay, we can go back. I work in this place where there's not so many resources. Maybe things that I've learned from my colleagues during this meeting, I can apply it and maintain patient safety and, provide my service.
That's good because, I mean, when you have a discussion, you find ways to do things better. On Speak Your Mind, Gold FM, only the classic hits. We'll be back in a moment. Welcome back to Speak Your Mind on Gold FM, only the classic hits. This is our final segment of the show, and our guest is from the CWM Hospital. He is the anesthetist consultant, and Dr. Bavou, so great that you've come in and let us know how important your job is and about how you're having the 30th regional meeting at the Fijian Hotel. So I'm sure you must be looking forward to it. And how this must be your, how many times have you attended this meeting?
Since I joined in 2010, this is probably the fifth or sixth one that I have attended.
Right.
I missed out on a few because I was on attachment overseas. So yeah, it would be the sixth.
Okay, so what did you think of it? I mean, attending 6 of them, like you said, it just gives you more ideas on how to be a better anesthetist.
Yes, Louise, that's the main thing. And to get by attending such a meet, we get to meet our colleagues that we may have, not met in a long time. We get to update ourselves on the latest, for example, standards of practice, ways of improving our practice. Share our experiences and just support each other. And we've always had a few guest speakers. So this year we have a few guest speakers, as we have had in the past.
Mm-hmm.
The theme of this year's meet is safe anesthesia during disasters.
Oh, that's interesting. So, how do you connect that
Right. So
as a theme?
we live in a region of the world where we are very prone to natural disasters, and Fiji not being exempt. The When you talk about disasters, you can have obviously natural disasters, man-made disasters, right?
Okay.
And two of our speakers coming this year from one is from Christchurch.
All right, New Zealand?
Yes, so he is one of the. If you do remember the sad incident earlier this year, the Christchurch shooting,
Yeah, massacre.
and it happened to so that anesthesia had a leading hand in during the management of those patients. So they will be sharing their experiences. I think it's very relevant for us here in Fiji because it's New Zealand is not too far away from us,
Yes.
and these days, something
Just
like
never
that,
know.
you never know.
Mm.
So from an anesthetic point of view, we'll have our friends from there coming and just talking on how they managed the whole scenario. They went about triaging patients and so on and so forth. There's also we have some training in the MIMS. Now, if you haven't heard of MIMS, MIMMS, this is a 2-day course. Basically stands for Major Incident Medical Management Support. It's a 2-day course to help medical specialists improve or give them a structured approach to medical management during disasters.
Okay.
So we will be having our colleagues from Australia and those who have already trained, especially in Fiji, the pre-hospital care trainees, emergency physicians. They'll be coming, giving us I think a 1-day course on that. So yeah,
That's
it's going to be
really good.
an action-packed field week and a very busy week for the anesthetists.
I can imagine you must be looking forward to it. I mean, it's
Yes.
something new because, like you said, Christchurch massacre. I mean, the anesthetists, they must have been, really had to do their job there. I mean,
Yeah.
gunshot wounds and all that, terrible. So, yeah, looking forward to
We do
sharing
look forward to
all the
hearing from
knowledge
yeah.
from different places. You've got New Zealand and what other countries?
Well, the other Pacific said there were 13, so
13,
Tonga,
eh?
13
Okay, all
in
right,
total.
13, yeah. So we wouldn't be able to go through all the 13. But that's fantastic. So that's happening at the Fijian Hotel. So what is it expected when you do go to this sort of meeting, you to bring back the knowledge to the doctors as well that you work with or the other...
Yes, what is expected is, you attend a meet like that and basically the end result is that everyone improves their standard of practice
Right.
professionally, and you learn something and you apply that to your everyday practice. That's the main.
Okay, so do you have any new drugs? I mean, since where you first, worked as an anesthetist, have there been any more new wonder drugs for pain?
For pain specifically, there have been. Yes, there are new drugs. Whether they are available in Fiji is another question.
Okay,
And it often comes down to cost.
yes.
But since our pain team clinic has come about, our aim is to try and make some of these medications hopefully accessible and available to our patients in Fiji who need them.
Yeah, I mean, goodness, suffering with pain, there's nothing
Yes.
worse. Yes. Okay, so can I ask you a bit of history before we finish off the interview?
Sure, Louise.
Who was the amazing person to discover, drugs that anesthetists
Right.
use?
So
Like it must be way back, I suppose. Maybe you studied it in school.
yeah,
Hopefully you still remember
I
just
think
very quickly.
The most well documented one is William Morton, who carried out the first anesthetic in 1840 something. I think in 1800s, yes. But he's probably if you Google anesthetics, William Morton's name is the one that comes up, and he was able to provide anesthesia and remove a lump from some's neck.
You see,
if I
that's
remember
in
correctly.
18 something.
That was that.
I wonder
Yeah.
what he used. What drug did you know?
I think it was a bit of ether and whatnot.
So ether is what? From a tree, or is it from a plant, or is it
Ether.
ether?
Yeah.
I wonder what that
Chemical
may
compound
be.
that one of the older anesthetics that
In those
is
days. I
those
mean,
days.
that's a long, long time
Yeah.
ago. So obviously you've got the stronger ones that were discovered later.
Then more modern ones have a better safety profile, and if you talk
I
about
see.
the other bad effects that were associated with the earlier ones, like nausea and things. But yeah, there are newer compounds that are
Okay.
chemicals that have a better safety profile.
Yes.
And that we're using now.
So I believe the medical field, they're always continuing to
To
study.
evolve and
Yeah.
hopefully improve. Yeah.
Okay. Well, that's it for our interview. Thank you so much for joining us.
Thank you, Louise.
Yes, it's great to have you. You have a wonderful meeting, and I must thank you on behalf of everybody in Fiji for the great work that you do.
Vinaka.
And Vinaka, that's anesthetist consultant at the CWM Hospital, Dr. Shem Bavou. Thank you for being with us on Speak Your Mind. Until next week, ni Samoa Demanda.